Why and how to implement emergency manuals at your institution. Emergency manuals are being implemented rapidly across the country and the world because they can save lives. In 2013, multiple groups joined forces, launching the Emergency Manual Implementation Collaborative. Focusing first on operating rooms and perioperative areas, our shared goal is to help institutions and teams consistently deliver optimal care to patients during critical events. We asked Dr. Richard Dutton, Executive Director of the Anesthesia Quality Institute, to comment on the role of emergency manual implementation in the future of patient care.
Anesthesiologists have developed many tools to rescue patients from life-threatening situations, from the laryngoscope to the pulse oximeter to crisis management. The latest of these is the Emergency Manual, a cognitive aid for any medical provider confronted with a crashing patient. This tool will save lives.
And the anecdotes that are already getting reported suggest a big impact in specific cases, even as best implementation practices are being refined and formally studied. The problem is that even when optimal care is well defined in the medical literature, it does not reach the majority of patients during critical events. This is true even for care delivered by experienced teams.
Why is that?
Well, our memories shrink under stress, and the stacks of relevant literature are rarely accessible under severe time pressure. Sometimes vital steps are never performed. That's why it's important for all of us to use cognitive aids, including emergency manuals, as part of the bigger context of crisis resource management and teamwork principles. So let's define some terms. Cognitive aids are tools to help people to perform important actions accurately and efficiently. An emergency manual is a resource that contains sets of cognitive aids, sometimes known as checklists, relevant for a specific clinical context, like the OR.
Sounds great for trainees, but shouldn't professionals know what to do?
Actually, none of us can be experts in delivering all the management details for every critical event. Astronauts, pilots, and nuclear power operators all train with and use emergency manuals extensively for managing critical events. These high-stakes fields have recognized that no professional gets the 10,000 hours of practice with every emergency that it would take to manage them well with memory and intuition alone. For all of these fields, there are of course times when physical actions, like immediate chest compressions, must be ingrained in our minds and initiated before emergency manual use.
So, in time-sensitive events, emergency manuals usually are not relevant?
Actually, human factors research shows they are both relevant and necessary. Remember the story of a flock of geese causing a freak dual-engine failure shortly after U.S. Airways Flight 1549 took off on January 15, 2009? Captain Sullenberger then flew the plane and communicated with air traffic control, while First Officer Skiles read from the dual-engine failure section of the emergency manual to ensure they performed the recommended management actions. With less than 4 minutes between the engine failure and their safe water landing in New York's Hudson River, the team used an emergency manual to help them systematically deliver the equivalent of optimal patient care for a rare critical event.
Yes, but patients are not airplanes.
You're right, but there is also compelling simulation-based evidence within healthcare. For example, increasing frequency of cognitive aid use was correlated with a higher malignant hyperthermia treatment score. When crisis checklists were available, failure to adhere to critical steps in management decreased by 75%. In other words, in these and other studies, teams that use emergency manuals get much closer to achieving optimal care than teams that do not.
Why would that be?
To summarize many cognitive psychology studies, if your memory is this big, under stress it shrinks to this big. And even if the kernel of knowledge is in your brain, it needs to reach your patient to help. And all the distractions interrupt your planned actions. These are some of the reasons why clinicians should use emergency manuals. For leaders, I want to highlight some system implementation lessons from the published literature and experience from institutions that have already begun clinical implementation. The stacks of relevant literature need to reach our patients to help, which requires both teamwork and appropriate management actions. The goal is to help excellent, well-trained clinicians to deliver known best practices to their patients during critical events, which often does not happen completely accurately and efficiently. First, emergency manuals must be readily accessible in a consistent location. Consider a durable physical copy for use during critical events, in addition to electronic versions for portability and review. Secondly, some form of training is necessary for achieving widespread effective use. Consider at least the brief videos in this set, hopefully in combination with integrating emergency manuals into team training programs simulating critical events. When clinicians have familiarity with format, as well as an understanding of why and how to use emergency manuals, effective use increases significantly. Thirdly, care may be improved by designating a reader role to assist the leader and team once immediate actions are initiated and sufficient people are available. The reader, assisting a leader, ensures all management actions are completed accurately and efficiently.
Why is it not enough to make emergency manuals accessible?
It turns out that humans often see only what they are looking for. Imagine that you always buy sticks of butter. If someone buys for you a round tub of butter, when you are looking in the refrigerator for butter, even with minimal distractions, you may not see it. That's because it does not appear to be what you need. Observations during simulated critical events showed a more severe form of this same inattentional blindness. Teams during simulated stressful events that had not been familiarized with emergency manuals usually did not use them. For example, during a malignant hyperthermia event or pulseless electrical activity cardiac arrest, they neglected to perform vital elements in management, even with well-formatted emergency manuals in plain sight. In debriefing after the simulated critical events, we asked, "Why did you not use the emergency manual?" And they often answered, "What emergency manual?" Many well-trained, respected clinicians had touched the emergency manual in order to throw it aside, but were not consciously aware of seeing it because they were not looking for it. Importantly, when we trained teams for just 15 minutes regarding why and how to use emergency manuals effectively, both use and correct management actions went way up. The brief familiarization regarding concept and format made all the difference, and clinicians enthusiastically asked to make the training more widely available, spurring this video project.
How can I, or local champions, start implementing at my institution?
Join leaders who have already realized the benefits of implementing emergency manuals. Delegate a local champion. Make emergency manuals accessible in all acute care areas. And familiarize all physicians and staff with why and how to use emergency manuals.
So, what's the background?
In the 1990s, Drs. David Gaba, Stephen Howard, and Stanford colleagues spread concepts for crisis management from aviation to healthcare. In the 2000s, Drs. Atul Gawande, Bill Berry, and Harvard colleagues spread effective tools for systematically saving lives by introducing various types of clinical checklists. Leaders at Kaiser Permanente and many more institutions, both small and large, private practice and academic, have launched related parallel efforts, ultimately joining together in the Emergency Manual Implementation Collaborative.